I think it is 2 o'clock and we can start. Welcome to the EDTNA ERCA webinar. Thank you for joining us today. Before we will start, I would like to thank V4CLS for continuous support of EDTNA ERCA, and this webinar is a result of our joint project between EDTNA ERCA and V4CSL. CKD associated pruritus is a common condition that patients with end-stage renal disease often suffer from. However, despite its high prevalence, this condition remains underestimated by renal care team and underreported by patients and also by nurses. The main goal of our webinar today is to increase awareness regarding CKD-associated pruritus among nephrology nurses and other healthcare providers working with renal patients. Our topic is assessment and identification of patients on haemodialysis with CKD-associated pruritus, the current role of dialysis nurses. Today with us is 3 experts on this topic, and the first one will present Natasha Lisotau. She's the EDTNA ERCA EC member and the publications unit of Kefalonia in Greece. And she's a PhD candidate, Department of Nursing, the University of Peloponnese of Greece. Please, Natasha, the screen is yours. And we will have discussion at the end of the session, and you can write your questions during the presentations on the question and answer box or in chat box. Please, Natasha.
Thank you, Jane. Thank you, Jen, for presenting. I would like to say hello and a big welcome to all of our colleagues who have connected this afternoon for this EDTNA ERCA webinar on the assessment and identification of patients on hemodialysis with CKD-associated pruritus, the crucial role of dialysis nurses. Okay.
Yes, perfect, thank you.
Okay, so I shall continue. So as Jane already presented to you, with this webinar, we aim to provide knowledge and tools that facilitate prompt identification and assessment of patients with CKD-associated pruritus, as well as to provide support for our nurses to assume their key role in the diagnosis of CKD-associated pruritus and on how to approach and identify those patients who are suffering in silence. So within the next 20 minutes, I'm going to present to you an overview of the prevalence pathophysiology of CKD-associated pruritus, the different pruritus and quality of life assessment and identification tools, some unpublished results of from our recent EDTNA ERCA survey on the CKD-associated pruritus, and the nurse's role in identification of patients with this condition. This webinar is a part of a collaboration project between EDTNA, ERCA and CSL V4, which has been taking place during this year and is only one of the series of educational activities that EDTNA ERCA is involved in to address CKD-associated pruritus in people on dialysis. This is a project that is dedicated to raising awareness on various medical nursing aspects around CKD and has included the survey, the EDTNA survey that was conducted during the summer on nurses' knowledge on the management of patients with CKD-associated pruritus receiving hemodialysis, 3 new EDTNA, ERCA, e-library articles, and of course, this webinar. There are many active and dynamic roles of dialysis nurses in the identification of patients with CKD-associated pruritus. And we want with this webinar to highlight this very much. Dialysis nurses are in a unique position to identify strategies in clinical practice and lead the management of patients' burden on their symptoms due to this condition. Dialysis nurses can support and encourage patients with CKD-associated pruritus to talk about their symptoms. Nurses function as a key communication channel within the renal care team and a significant link between the nephrology and the patient. Now, some background on the CKD-associated pruritus. Pruritus can be defined as an unpleasant sensation of the skin, leading the patient to the desire to scratch, and can be acute or chronic. Chronic pruritus is defined as itching present more than 6 weeks, with little or transient relief from scratching. CKD-associated pruritus is prevalent and distressing condition for patients with CKD undergoing hemodialysis. Recent data from International Observation Study, the DOP study, show that 67% of patients on HD reported that they were bothered by pruritus, with 37% reporting moderate to extreme symptoms. The understanding of pathogenesis of pruritus in CKD is multifactorial. For patients with advanced kidney disease or on hemodialysis, pruritus can persist dramatically, affecting the quality of life of patients. Despite over 50 years of research, CKD-associated pruritus remains underestimated, underreported by patients and healthcare professionals, and undertreated in consequence. CKD-associated pruritus is also common among patients with non-dialysis CKD, with 24% of patients across all stages of CKD suffering from at least moderate pruritus, while the prevalence of severe to extreme pruritus across all stages ranges from 10 to 13%. Now let's see what are the consequences, what is the burden for patients and the systems, the healthcare systems. Patients, they have reduced quality of life. There is an increased mortality. There is a poor sleep quality, depression, anxiety, social isolation, missed hemodialysis sessions, increased healthcare costs, and increased infection risk. So there's quite a lot to take into consideration. And in this slide, we can see the prevalence of CKD-associated pruritus across the countries, which is around, as we mentioned before, 67%. The prevalence we can see here of moderate to extreme pruritus was lowest in Germany and highest in the UK, ranging from 26 to 47% respectively. The complex pathophysiology of CKD-associated pruritus. Due to the uncertainty concerning pathophysiology and treatment, the condition, unfortunately, is often overlooked and remains one of the challenging patients' complaints. Patients with CKD-associated pruritus are trapped in a vicious itch scratch circle. Pruritus leading to the unconscious reflex action of scratching, that is, in turn, damaging the skin and exacerbates pruritus. The mechanism underlying each are complex and sit at the boundary between neurology and immunology. The etiology of CKD-associated pruritus is multifactorial. Although the pathophysiology is not fully understood, we know that there is a combination of several mechanisms that appear to contribute to its occurrence. And these include, as we see in our slide, these four conditions, these four phenomena, and these include the dysregulation of toxins, the peripheral neuropathy, the endogenous opioid dysregulation, and immune system dysregulation. The accumulation of uremic toxins in the skin and activation of the non-histaminic EAT pathway has a result of peripheral neuropathy, immune system dysregulation, and or opioid imbalance with subsequent macroinflammation and cirrhosis. So there is quite a lot to take into account when we're looking into investigating this condition. And again, we can see here the localization of CKD-associated pruritus. Its distribution, it has specific skin areas that can be affected, mainly back, face, arm, or it can be generalized all over the body and can often be symmetrical. The clinical presentation is variable and non-specific and can be sporadic, continuous, and can be any time during the day. You can see the images here of our patients. The relationship between CKD and pruritus is often not well understood by patients, and many patients fail to report it to their healthcare providers. There are many reasons for patients failing to report symptoms, either lack of awareness, itching not perceived as a health issue, or they are unaware that itch is a symptom associated with CKD, or lack of prompting by healthcare professionals. Patients' attitudes, history of unsuccessful treatments, fear of additional medications, acceptance of itch as inevitable. And in terms of healthcare professionals' attitudes, we can possibly see here colleagues saying the time is too limited, or other health issues are prioritized to be managed, or there may be lack of awareness around treatment options. And next to this slide, we can see who do patients report their symptoms to. We can see nephrologist, dialysis, nurse staff, dermatologist, primary care doctor, but we can also see that it is a 17% of patients who do not talk, who do not approach, who do not talk about their symptoms. So that is of great concern. In this slide, we can see the proposed algorithm by Agarwal, which was published during this year. And this is an algorithm that describes screening, diagnosis, assessment of CKD-associated pruritus among the patients undergoing hemodialysis. Basically, it concerns three steps, three phases: the screening, the diagnosis, and the severity assessment. We should ask the patient if they itch every 3 months, and if yes, we have to establish, differentiate diagnosis if the patient indeed has CKD-associated pruritus present. If no, then other conditions should be investigated and treatment should be explored accordingly. If yes, we have to explore assessment tools, the severity tools. This is a tool that you can see in your screen that I'm going to describe in a minute. And basically, we need to assess the intensity and the impact on quality of life. Diagnosing and scoring is very important. The 3 pillars of proactive assessment is identification of pruritus. Then second, we have to assess the pruritus intensity. And third, then we have to understand the impact of patient's life. You can see the tools here that are established to assess and help us clinicians how to manage pruritus. The diagnosis here is with this slide. You can see that we have to exclude other potential causes of itching. So we have to have chronic pruritus that is present more than 6 weeks in a patient with CKD. Then we have to see, does the itching arise from visible skin lesions? Does the patient have history of pre-existing skin disease? If yes, then we have skin disease or prurigo nodularis. If no, is there another comorbid condition that may explain the itching, like other possible comorbidities, other dermatological disease, or metabolic endocrine disease? If no, then we have to consider diagnosis of CKD-associated pruritus. There are several simple self-reported assessment scales available to evaluate the presence and severity of CKD-associated pruritus. Currently, there are some scales that are divided into 3 categories. In this slide, you can see the severity scales that are measuring each severity, the multidimensional scales that you can see later on in our slides, which basically they measure several itch characteristics, and the quality of life scales that are assessing the impact of itching on patients' quality of life. In these severity scales tools, we see the visual analog scale, the numerical rating scale, the verbal rating scale, and we also have the kidney disease quality of life short form, which is a tool that has been commonly used to evaluate the quality of life of patients who are they have a chronic kidney disease. And there is a question number 20, that is exploring the pruritus in this questionnaire. Next, we want to present the simple validated instrument that can be used to assess pruritus, and this is the validated version of the NRS, the 24-hour worst itching scale, which is used for patients to grade the overall severity of the worst level of their itching. And this is important because this is done within the previous 24 hours. So WI-NRS is also included in the proposed CKD-associated pruritus algorithm by Agarwal that we presented earlier. And it is suggesting that score equal or higher than 4 indicate moderate to severe pruritus. Then in this slide, we present the multidimensional scales. The most commonly used are the 5D itch scale and the itching severity scale. But these are mostly instruments that are used in clinical research studies. And what it is important to say that we have the self-assessed disease severity, the SADS scale, which is very commonly used. It can be used in clinical practice because it's very fast. You can see here that this allows patients to categorize themselves into one of these 3 types of patients, A, B, C, depending on the severity of signs and symptoms. So ranging from type A without CKD-associated pruritus to type C, which is deeply bothered by itch with scratching, lesions, and sleep disturbances. SADS is a validated questionnaire that may be used for assessing the impact of its severity, and it is proposed that patient type B and C indicate moderate to severe pruritus. Overall, in case CKD-associated pruritus is diagnosed, the renal care team is recommended to assess itch intensity as well as its effect on patients' quality of life using the scales such as WY-NRS and this SADS instrument. In EDTNA, we conducted a study on CKD-associated pruritus in which we aimed to explore the existing knowledge on the management of patients with CKD undergoing hemodialysis. Here are some unpublished data that we have results from nearly 300 participants across 15 countries. According to our respondents, our hemodialysis nurses, up to 70% of patients were affected and nearly 40% experienced moderate to severe pruritus. So the majority of respondents indicate that only up to 20% of patients were actually diagnosed. Not all patients talk about their itching with their renal nurse, so this is very concerning. In this slide, we can see that according to the majority of our survey respondents, it is only 5% of patients diagnosed with CKD-associated pruritus, and these are the ones that are talking with their renal nurse. So we have a lot of work to do here, and we need to encourage our patients to talk to us about their symptoms. According to the survey respondents, the majority of patients don't feel comfortable to talk, and this is another very important topic. And they feel there is no available treatment for their problem. So we have to look on this as well. There are active and dynamic roles, as I commented at the beginning of this presentation, for the dialysis nurses. They have active roles in the identification and education of patients. And this is very, very important as they have more face-to-face interactive time with their patients. Nurses spend a lot of time, 3 times a week in the dialysis unit. They speak the patient's language and have an open ear for concerns and problems. Apart from proactively informing patients about the chances of being affected by each skin and educating them about the symptom burden in order to increase self-reporting, the renal care team is also recommended to carry out routine symptom assessments. How we can do that? We can recommend that we should do bedside and scheduled clinic consultations, utilize routine symptom assessments in daily practice. And this is to be done through patient-reported outcome scales, instruments such as the ones that I presented to you, the W1RNS and SADS. Promote optimum communication within the renal care team. We should definitely have to promote self-reporting, and we have to make our patients to speak. We have to make them stop from suffering in silence. Thank you very much for your attention, and I pass on to Afra.
Thank you, Natasha, very much. You raised definitely a very important point, how to assess the pruritus, CKD-associated pruritus. And our next presenter is Afra Plana. She is also EDTNA ERCA volunteers. She is a scientific board member, and she is postdoctoral research lecturer in the Facility of Nursing in Spain. Please, Afra.
Okay, thank you very much. So what I'm going to do in this part of the webinar is just focus on the psychological part of the pruritus that affects to the patients. So starting from the next slide. So today we're going to talk about psychological impact on patients' quality of life associated pruritus. So we're going to focus on the quality of life. And I would like to put attention to the nursing perspective on the management of CKD associated pruritus in relation to the quality of life of these patients that Anastasia has already been through a little bit. So chronic kidney disease associated pruritus is a common condition which burdens the lives of people who suffer end-stage kidney disease, especially those receiving hemodialysis. However, in PD patients, pruritus is also associated with worsened quality of life. So nearly half of the patients who are hemodialysis treatment suffer from moderate to severe pruritus. Persistent pruritus results in worsening the health-related quality of life over time. So only 1% of medical directors estimated same prevalence. So even the medical directors, they do not see how pruritus is there within their patients. So I would like to highlight this within an example in hemodialysis units, the difference in the management. For example, when we actually want to manage anemia or hemoglobin. No, so in the first one, anemia, it is reported as a very important part of the process, and we do collect blood every 3 to 6 months, depending on the protocol on each unit, of course. But would you suggest that this assessment is done in the pruritus for these patients? So often it's necessary to assess and treat this anemia. So for these patients who suffer pruritus, also should be done the same. So why is it not part of our daily practice? So the same with quality of life. Why do we not assess these aspects of our patients? It is as simple as doing an ongoing questionnaire, maybe at the beginning and then throughout every 3 to 6 months, for example. And this way we can assess and decide to create a strategy to make a better treatment for these patients. Well, in dialysis facilities, 21 to 50% of patients reported having severe CKD-associated pruritus. So would you think that 21 to 50% of our patients would be suffering anemia? I don't think so. So this is something that we should actually think about it, and we should all work together in order to assess and to treat this as holistically our patients. In the next slide, I would like to talk about the quality of life itself. So since more than a decade ago, it has been proved then that when pruritus bothered patients with CKD, it has a direct effect to their quality of life. In this publication that I'm showing you in this slide, which was collected more than 70,000 patients, collected data, a statistically significant decreasing trend in physical and mental scores of quality of life were observed. So from the lowest to the highest itchiness severity category. So in general, increasing skin itchiness severity was associated with lower quality of life scores in using the survey Kidney Disease Quality of Life short form, KDQOL, for those who are familiar to this, and presented higher scores in the mental score. I would like to mention that there has been different studies correlating many variables with pruritus level, such as, for example, venous access. Those with central venous catheter have the highest scores of pruritus, or EPO dose, or hemodialysis sessions, or malnutrition. Those variables have been correlated with pruritus. And because all of those interfere somehow to the quality of life, these data could help health professionals to guide the strategy of treatment to improve the management of pruritus, among others. In the next slide, Yeah, I would like to talk about other relevant studies, such as the one reported by DOPS, shows similar results. It shows how self-reported pruritus was strongly associated with both physical and mental, as you can see in this slide, quality of life, in a way that quality of life clearly deteriorates when increasing pruritus. Moreover, we can see in this figure how the severity of pruritus symptoms affects directly to health-related quality of life. So in other words, the higher the pruritus intensity, the worsening of the quality of life. So also here we're talking about now the severity of this pruritus, which is also interferes. And it happens with both instruments. So here has been used the Skindex 10 and the brief itching inventory. In this case, the intensity of pruritus was measured with the visual analog scale, which is the scale that measures from 0 to 10, the intensity. If we study in further details the effects that pruritus has in quality of life, we can see how when pruritus is persistent in time, it is when affecting the physical subscale of quality of life. So again, the persistence of it is what it affects to the person in the end. So however, on the other hand, when pruritus is no longer persistent, mental subscale of quality of life improves. So again, it is about the severity and the persistence of this pruritus. This explains the negative effects that the persistence of pruritus can have to all areas. The burden of CKD-associated pruritus signs and symptoms might inhibit patients' ability to work, to maintain an active social life. And we can see in this slide how there is a higher proportion of patients worried about the appearance of the skin from scratching and feeling depressed about the itching. On the other hand, pruritus also affects to the interaction with other people, and it makes it hard to work. So this data shows the relevant and very significant aspects of our lives, how they can be disrupted because of pruritus, such as the appearance of the skin, feeling depressed, feeling embarrassed, difficulty to work, interact with others. So this actually really interferes into our social lives. The majority of patients with CKD-associated pruritus suffer from disturbed or restless sleep. We can see in the first figure how when pruritus is extremely or very much bothering the patients, they are awake at night, followed by sleeping during the day. And finally, in the first figure, we see how patients do not get enough sleep when itchiness bothers them very much or extremely. So as you know, sleeping can actually really interfere into our quality of lives if we don't have a good quality of sleep. In the second figure, we see how the more itchiness bothers to the patients, the higher the proportion of patients report 3 to 7 days per week of restless sleep. In other words, pruritus can directly affect the sleep quality of patients with CKD. Additional cross-sectional studies have found a negative association between pruritus and sleep. In a study performed with 1,700 Japanese haemodialysis patients, shows that 34% with mild or moderate pruritus and 70% with severe pruritus complain of sleep disturbance. In another study that was performed in Italy with 139 patients of hemodialysis, also show, and 30 patients with PD dialysis, also shows how pruritus was associated with an 8 times higher adjusted odds of poor sleep. So again, this is all data to justify how it really interferes the pruritus into our sleep quality. All in all, this slide explains with a very high number of participants in the DOPS research how pruritus affects directly to the quality of sleep. Moreover, this can have a direct impact on quality of life, of course, because not having enough sleep interferes into our daily lives. In this slide, we are presenting data that correlates the level of being bothered by itching with depressive characteristics of the patients. Patients with CKD-associated pruritus are more likely to be diagnosed with depression compared with hemodialysis who do not have this issue. A significantly higher Beck Depression Index Scale, I'm sure you are aware, know this tool, was seen in patients with more severe pruritus versus less severe or not pruritus at all. So the Beck Depression Scale shows this correlation and how these patients actually do have depressive symptoms. Moreover, the use of treatments for depression was greater among patients with more severe pruritus versus less severe pruritus or no pruritus at all. And I would like to add another topic here, which is the gender differences, how women are more medically treated for depression than men, as they've already been published in different data. Now, just continue. So patients with severe itch were more likely to miss dialysis sessions and require longer recovery time versus those without itch. We can see the relevance and consequences that pruritus can trigger in relation to the dialysis treatment itself. In this figure, we can see how patients who suffer from extreme degree of being bothered by itchiness are in higher prevalence of missing dialysis sessions. And on the other hand, the same patients who suffer from extreme degree of being bothered by itchiness have a higher recovery time following dialysis. Again, all in all, this longitudinal DOPS study gives us very relevant data and helps us to think about the serious impact that pruritus can generate. And we have seen in the previous presentation how little attention is given not only to the patients, but also to the clinicians. This continues confirming what we are discussing during this webinar, the relevance of pruritus in all areas of quality of life. Severe CKD-associated pruritus has been associated with an increased risk of mortality among patients undergoing hemodialysis. So we're going, as you can see, I'm showing you data that is pruritus related to quality of life in different areas, such as depression, such as sleeping disturbance, and now I'm going through the mortality. In this slide, we present the results of the same large study conducted in Japan, where a total of 1,700 patients undergoing the hemodialysis participated and were followed during 24 months or until death. So the prognosis of patients with severe uremic pruritus was significantly worse than those with other conditions. So they also found that severe pruritus was an independent predictive factor for death. So it is now time to pronounce loud the relevance of this significant clinical condition. And finally, nearly finishing, CKD-associated pruritus patients demonstrate increased medication use, such as antibiotics, erythropoietin stimulating agent use, and this is what I'm presenting in this slide, only those two examples, and may have a higher economic impact versus the patients without pruritus. So in this slide, I just want to mention the results when assessing pruritus in CKD patients. As results from Lopez et al. In 2022, this study, it was used the Skindex-10 questionnaire and a single question from kidney disease quality of life, which is question number 20 that Anastasia mentioned earlier. And in conclusion, from the authors showed that both instruments correlate, and therefore utilizing one single question to assess if patients are bothered by itchy skin can be feasible and efficient method for routine assessment of pruritus related to quality of life. And we could also differentiate physical scores or mental scores of quality of life. So all in all, and the next slide now, I'm going to talk about the nursing management. So as you can see, the assessment should be the priority for us as nurses in order to actually cope with this situation with the patient. So to finalize, I'm going to talk about the aspects of nursing management of chronic kidney disease associated pruritus, which it should be focused on incorporating routine assessment. As I said before, every 3 months we collect blood, every 6 months we collect blood. Well, every 6 months we should also assess quality of life, pruritus, and among others. Maintaining patients' clinical communication, very important within the patient and the clinicians, either nurse or social worker, whoever is around. Use universal measures of assessment in order to improve and compare therapies, as they can vary widely. So if we use one single instrument, we can actually talk together internationally. Maintain patients and family and caregivers informed and maintain this dialogue all throughout the time that they're on dialysis. Reducing potential risk factors that pruritus can develop, as we already mentioned before, reducing factors such as sleep disturbance. Development of clinical practice guidelines and update them, focusing on the holistic care of CKD patients, of course, including pruritus. And patients should meet KDIGO defined goals for dialysis efficiency and mineral bone disease treatment. And if not, we should help patients to achieve these goals, because dialysis efficiency is not only part of the management, as patients also develop the CKD-associated pruritus independently of dialysis goals. So finalizing now, I would like to give a few take-home messages. Firstly, we should recognize that pruritus is under-recognized, under-reported, and under-treated, as we already mentioned before. Therefore, it is our responsibility to raise awareness within patients and families about the serious consequences for patients that pruritus has, not only within psychological factors such as the depression, the loneliness, the social life affecting, but also restless sleep, increase of hospitalization, risk of mortality. Patients have become increasingly vocal that although mortality and life expectancy matters to them, the quality of life and particularly the relief of symptoms associated with their treatment are in many cases more important. There is a need to acknowledge the importance of CKD-associated pruritus symptoms management to patients and understand the symptoms' underlying pathophysiology. If we cannot add years to the patient's life, we can at least add life to their remaining years. So thank you very much for your attention.
Thank you very much, Afra. Definitely very, very useful, very useful points for takeaway message. And it is definitely our responsibility to initiate discussion with the patient about pruritus. Okay, can you hear me? Okay, thank you.
Thank you.
So our next speaker for today is Daniel Gallego. Daniel is the president of European Kidney Patient Federation and the president of Spanish Federation of Kidney Patient Associations. And he is a kidney patient on hemodialysis since 1995. Welcome, Daniel. And I would like to remind to our participants to write questions for discussion on the question and answer section, please. Please, Daniel.
Many thanks for EDTNA kind invitation. I think it's a crucial point, pruritus and itching, as you can imagine how it's affecting the quality of life and how it's affecting not only patients but also caregivers. So I'm going to try to share with you the importance of managing of pruritus especially in dialysis patients, because the nurses playing a crucial role for us always, but especially on dialysis. So I'm very happy to be with you today. And of course, we have shown, and Afra and Anastasia have been talking about the importance, about the outcomes, and until 80% of patients were very much extremely bothered by itchy skin, and you can see here in this DOPS study running in 17 countries, that at least until almost 70% of medical directors underestimate the prevalence of pruritus in their facilities. So among the patients, until 80% use no treatment for pruritus. So the conclusion is that many patients could be improved by increased awareness and treatment of CKD-associated pruritus. I think this is a very strong conclusion, that we need to improve the quality of life and the quality of care of these dialysis patients. As you may know, the standardized outcomes in nephrology are classifying in 3 tiers the importance of the core outcomes, and although the itching is then in the third tier, I think is very important for us, and is completely underestimated and underdiagnosed, and we need to maybe redefine these core outcomes, and maybe during the incoming years, we will see that itching and pruritus becomes more important for the future, especially in the quality of life and the patient report outcomes and the patient report experience. And of course, during this year, we have published this study with the Living Well with Kidney Disease and an Effective Symptom Management, a consensus conference proceedings. And the most important conclusions about the CKD associated pruritus, of course, is the prevalence is until 35%, but as you can see, is completely underestimated and underdiagnosed. It is the lack of awareness between the professionals, but also between the patients, because we get used to live with the pruritus, and you don't really you don't realize that you are with this itching during the whole day, and this lack of awareness is related with this underestimation. And the most important thing is the psychosocial burden. I think it's a high priority in hemodialysis, and we need to ask more the patients. We need to ask more the symptoms, and to ask more about the patients. How are they feeling, the perception of the reality with the pruritus? There is, without any doubt, an unmet need, and this pruritus is affecting directly the quality of sleep, and maybe this lack of focus, because you are the whole day with the symptom, and produce this inability to work, and inability to do more or less the same things. But the most important thing I would like to share with you today is the most common and most reported symptom on hemodialysis. So you can imagine the importance of the pruritus in our dialysis patients. And another important thing is we need to address the humanistic burden of CKD pruritus, because it's affecting every single day to our people and to our patients. It's a never-ending story, no? It's the whole day is affecting you, and 24/7, and produce you this irritability, and affecting and changing your daily life activities. I don't know why is running without me. The slides, and the patients reports that is unbearable, and is a side symptom, is considered normal. And we need to change this cultural belief that it's not normal to have a pruritus, it's not normal to have itching, and of course, maybe at the end is producing these bounds that you need to treat with more severe outcomes. And at the end, it's a question of dignity. You know, until today, we didn't have any real option, any therapeutical option, and we deserve an option now, because it's totally related with health, related with quality of life. Until today, you know, the recommendation where you cut your nails, or maybe it's an unpleasant symptom, and it's almost normal. So at the end, we deserve this option, no? And I'm going to share with you the burden of CKD pruritus for patients. We have published and we have released this white paper, the Living with Chronic Kidney Disease Associated Pruritus. You can download, of course, in akpf.eu. It's available for free for everyone. And we have captured testimonials and how is the burden. No, of course, burden is a distressing for every single kidney patient, especially on dialysis. and of course it's chronic, and it tends to all over your body, the trunk, the back, the front, the legs, and you can read here some testimonials that usually is start like it will take 2 or 3 days and dissipates and goes, but it's not the case. At the end is all the whole day, 24/7. Another important thing is it never goes away. No, the patients report that it tends to be all over the body, and it never goes away. And another patient says that it's ruining my life, or it is ruining their life. Often I am lying awake with the nights in a row without being able to sleep. So you can imagine how desperate or how it's affecting the quality of life, and doesn't look like you are right. You are sitting with your friend and eating, and you feel embarrassed, no, and you feel shame about to be with the eating with the whole body, and of course it's very annoying, irritating, and they have a big impact on their lives. You can read here how it impacts the severe and the uncomfortable, and cannot pay attention to the people because we are focused on eating, and we have learned to live with this condition. And we need to change that, no? Because it's very, very annoying. And some situation, you are really sick and tired with the itchiness. And another important thing is we don't have a clear diagnosis about the itching on dialysis patient, no? We don't have a real therapeutical options until today, and hopefully we will change that in the future, but we don't know the causes, and I think we are getting used to live with a quarter of a year, realizing that your kidney disease and your itching is affecting you the whole day. And of course there is a medical needs, because we understand that there are different ways to manage this, but not to stop it. And the patients are a little bit fed up about that. No, we need to stop the itching. We need to stop the pruritus at the end, and this is why we are here today. No, to try to tackle this burden of EKD for the patient. And the conclusion of this report about the CKD associated pruritus in patients is that the CKD is an unbearable condition to live with, both physically and psychologically, and the itch never completely vanishes and damages patient quality of life. And regrettably, healthcare professionals too rarely proactively warn the patients and the condition can arise with dealing with the chronic kidney disease. No, and patients, the treatment prescribed, they each provide the best limited and temporary relief, only with consequently in many different treatments. So the conclusion, of course, is to try to the role to involve more the nurses and the healthcare professionals, and involve more the patients to ask more and report more about the CKD associated pruritus. This is more or less my proposals or my advice for us dealing the patients about CKD associated pruritus, because nurses, you are specialists in caregiving, so is your task, is your duty. So please ask more the patient, and of course we will recommend the patients to report more about CKD associated pruritus. And maybe a proposal is we can create, or we could create, a tool to detect very easy with a few questions, few validate questions, 3 or 4 questions. A tool, maybe we can create a tool to detect the CKD associated pruritus, just asking 3 or 4 questions. As we have created in the past emotional tool, emotional disorder tool, just asking 3 or 4 questions. Maybe it's an idea to create a new tool, because the key to empower people is education, is not only information. So we need to empower people, educate more patients and educate more professionals to ask more and create awareness and increase awareness about CKD pruritus. And this is the final objective of this webinar. On another webinar is to increase the awareness of CKD pruritus in the nephrology community, in the nursing community, and to take more or less the CKD associated home messages. I think to understand pruritus and how affect the kidney patient's life is truly important. Is completely underestimated, and you have seen is underdiagnosed. And I think we need to include the patient report outcomes and the patient report experience, establish mechanisms maybe in the medical history, or maybe to try to establish a mechanism to capture this patient report experience and outcomes, and of course include the patient lived experience associated pruritus. Please focus more on how well are you living, and not only on how well is your hemodialysis session, because we are spend a lot of hours at home and our daily lives, so it's more important how well are you living. And the key, as you know, is education, more education for professionals and more education for kidney patients to try to ask more about the pruritus and report more of the pruritus. And finally, and last but not least, you are a specialist in caregiving, so I think we are on the same team, and we need to give a clear solution to improve the quality of care and the quality of living of people with chronic kidney disease. And many thanks for your attention. My pleasure, and we remain to your disposal for questions.
Thank you. Thank you, Daniel. I think that to focus on how well our patient living is not related only to pruritus, but that we provide to our patients. We have some questions on our questions and ask box. I think it's for the first question is to Natasha.
Yes.
How would you? Okay, you can read it. Okay, do you see it about identification? Recommendation for the identification tool and the assessment.
Yes, the question is on the WI-NRS tool. This is a simple validated instrument. We basically, through this instrument, we ask the patient to rate the worst each that has felt in the previous 24 hours. This quantifies patient-reported severity of itching symptoms. It is, as I presented it, validated in a 10-point scale. We consider this is proposed to be used by the algorithm, the ERCA. It has been approved to be a very reliable tool, which is actually a reduction of 3 NRS points bigger or equal if the score is as high as it is. This is associated with a clinical meaningful change in each severity of the patients with moderate to severe CKD associated pruritus. There is a definition in categorization with respect to what we define mild pruritus, and this is a categorization of points between 1 to 3, then a score of 4 to 6 moderate pruritus, 7 to 8 severe pruritus, and then 9 to 10 very severe pruritus. Again, as I said, this is recommended by the recent publication of ARCA by the algorithm, and this is why we presented this tool. I don't know if our colleague needs more information on that.
May I ask also regarding tool, Natasha?
Yeah.
What would you recommend for, really for daily practices for nurses, because we are over-tasking, we have a lot of patients,
This is
working in the unit.
Sorry, Jane, I couldn't.
The most useful tool for doing it, on daily practices. I mean, to use
This can be incorporated in our daily practice. This can be included in our assessments. As Afra mentioned before, this is a completely new area. This is something that we haven't addressed before. Usually we question our patients so far within the research context. We go with a questionnaire like the 5D EAT scale, and we ask our patients about their symptoms. But in daily practice, some of the, for example, this tool, the 5D EAT tool, is not very easy to work with in daily practice. So simple questions that, like in this particular tool, we can use and we can incorporate into our daily practice and ask the patients in a form about their symptoms. As I said, this is an area that it has not been addressed before. This is something we can gradually incorporate into our daily practice. I'm very happy we have, as EDTNA, we have started addressing that, and hopefully we will welcome and encourage our colleagues in who are attending this webinar, that they will start considering incorporating these into their daily clinical practice.
Thank you. I think we have
more questions.
Interesting question for Daniel. Why do patients not reporting itching when talking to doctors? Do we ask wrong questions? From the patient point of view, what do you think?
Yeah, dialysis units maybe is not the best place, no, to report some things like sexuality, sexual health, or maybe itching or pruritus, because maybe you are afraid about the answer, or maybe you don't have a very good relationship. It's important to create this good relationship with the nurses, and because you are confident, we will report to you maybe more than the physicians, and maybe the patients needs to report a lot of things, maybe creatinine, asking for diabetes, maybe there are some other things that they consider more important than itching, but we need to change that, no? We need to change this cultural belief, or maybe we need to change as Anastasia was saying, or Afra were saying, we need to check it every 6 months or 3 months about the itching, sexual health, and other important things that really matter to the patient. So maybe patients should report it, but just in case they don't do it, we need to ask them. This is the final conclusion.
Thank you. We have a question about pre-dialysis period. Natasha, can you answer?
Yeah.
Sonia asking about approach to this topic in pre-dialysis patient group.
Yes, this is an area, the CKD associated pruritus. In this webinar, we presented the topic with regards to patients receiving hemodialysis. But CKD associated pruritus is also common among patients with non-dialysis chronic kidney disease. About 24% of patients across all stages suffer from this condition. This can be also investigated and can be assessed. But in this webinar, we presented the population of people who are under hemodialysis, and they're suffering from CKD associated pruritus. But yes, the tools are to assess the pre-dialysis period as well.
Thank you. Another question. Should nurses assist patients when asking CKD-associated pruritus with questionnaire, or it is okay that patients do it on their own without assistance? I want patients to help us to treat them.
I think it's a very good question, actually, because we tend, when we give out questionnaires, we sometimes find it difficult communicating sometimes the meaning, and sometimes we have to help to assist them. So that is why the key to this is to develop as much as possible simple questionnaires, so we don't develop bias, if I may say. We don't help during the process of assisting them, so we don't actually affect them in any way to answer the questions in another direction. So we don't want to influence them. But sometimes there is this obstacle. We may experience that we may have to assist patients if the questionnaires are not understandable, especially if you approach the elderly, our old elderly patients. Yes.
And besides that, of course, there are people with disabilities, or maybe we need help not to fill all the questionnaires, and maybe you feel embarrassed to tell the truth. And so I think it's important to create this good communication and trustworthy relationships, to try to see behind, because some patients are not telling the truth because there is a bias, or maybe we are asking directly and they don't want to report the truth. So I think it's truly important to ask more and to help them to express all the feelings and all the perception about the reality, because sometimes it's not easy at the first. So maybe we need to ask twice or three times, especially in this kind of things that are really annoying to people out of the dialysis units.
Do you think that pruritus actually is something taboo, like sexual discussion, with patients?
I think, no, I don't know, Anastasia, you have the hand up, but it's not, of course, like a sexual health or something like that, but maybe you feel embarrassed to feel itching 24/7 in front of your friends or in front of the, and it's very annoying you, and maybe you don't give the importance about the itching like other people do, no? But the important is what are you thinking of about this, and what are your feelings, and maybe some patients are feeling real embarrassment about that. So we need to be careful about that. Yes, Anastasia, sorry.
Yes, I just wanted to add something on what you were just saying, that I presented in my parts as well, that in order to what it is within what we recommend, in order to avoid all that, we need to develop the environment. The environment in the dialysis unit is not perfect. It has a lot of noise. We have in close distance many patients around the patient that we are questioning. So it is recommended that we either schedule clinics, so we take this patient out of the dialysis environment, make this patient feel comfortable, start a consultation. This can be done with education when we train our patients. This can be done when we want to make questions either for research, either for clinical practice. It's not it's not a nice environment in the dialysis during the dialysis session. So I have to highlight that we have to consider time for the patients to relax, feel comfortable, and get open to us. And yes, from my experience as well, from my unit, I understand that patients don't talk about it. We see patients coming with lesions and scratch marks, and we have to really approach them and ask them, how did you do that? What is your have you been itching the whole weekend, for example? And they come with the answer, but very in a very shy way. There is embarrassment involved, and the key to this is the way we approach them and the way we create this environment to make them get out of this silence, because there are a lot of people suffering in silence, and that's for sure.
Because you are doing 24/7, you don't realize that you are doing every day, no? You are feeling itching, and you produce these bounds or pricks or something like that, and you feel embarrassed because you feel like you are a monkey. You are the whole day you are feeling this pruritus. So at the end, you are totally right. There is an embarrassment associated with the pruritus, especially on dialysis. Yeah.
If we want to get real answers, yes, we need to approach them in a very discreet way, and in private consultation. This is my recommendation.
We have a number of questions about possible treatment. Do you have any?
Yes, there are treatments. Yes, we are in this webinar, we are focusing on the assessment and identification, and there are also the nurses in that. Treatments are already used, and they are already out in the pharmaceutical market. But we are not going to discuss treatment, I think, in this within this context of this webinar.
No, but of course, what is important that until today we had only antihistamines, or gabapentin or this kind of things, but that produce you side symptoms, and it's not a very appropriate treatment for this. So, and for now, luckily, we have a new therapeutic options to treat specifically the pruritus and the itching, and the studies are very promising studies that reduce or eliminates completely the pruritus on dialysis patients. We have seen the results, and luckily we will have it available for everyone in the incoming months.
Yes, therapy has already been used, as you said, Daniel, and there are new agents, new drugs that are going to be out. So there's quite promising research on that. But yes, substances all well known like gabapentin and pregabalin and antihistamines have been used in the past, and new drugs are coming out. So we are hoping that new therapies will be promising for our patients.
I think we have lost Jane.
I think.
So
maybe I think this is about the time to
close.
close and
Jane's coming.
thank our attendees. We lost you, Jane, for a second. There is
thank you. Yes, thank you. I lost.
There are many questions that obviously our attendees are very much interested, and we are happy that we raised awareness with this webinar. I think it is time to close this webinar.
I just want to add that I think that we all will come back to our units and will pay much more attention to this problem, and we definitely succeed to raise the awareness. At least this is my feeling. And thank you for panelists, for the participants, for presenters. Thank you for great discussion, and thank you for CSL for support of this project, and please fill in the questionnaire after the webinar, and thank you.
My pleasure and honor. Thank you so much. Take care.
Thank you, Daniel. Thank you.
We keep in touch.